Well, a bad bite can be a number of things. The malocclusion can be related to how the teeth are positioned in any one of the three dimensions. So we have what we call a normal bite, where the front teeth just overlap each other by a millimetre or two, and when viewed from the side, the teeth, top teeth and bottom teeth, are on a little bit of an angle, and they overlap by about a millimetre or two. So when we have an increased overjet, there's a bigger gap between the top and bottom teeth, and they're not actually touching correctly. The other dimension is the vertical plane, and that's where the top teeth overlap the bottom teeth by too much, more than that 1 or 2 millimetres, and that creates what we call a deep bite. Now the problem with a deep bite is, of course, the teeth are scraping a lot more on each other when they're biting, and that leads to premature wear of the bottom teeth and premature wear of the back of the top teeth. But there are other aspects to a misaligned bite. The top jaw should always be a little bit wider than the bottom jaw, so the bottom teeth nestle up into the bottom jaw, and sometimes the reverse can happen, where the top jaw is too small for the bottom jaw, or the bottom jaw is too big for the top jaw. Any one of those bad bites, or a combination of those bad bites, leads to the teeth biting together incorrectly, which over time increases wear and tear on the teeth, and can lead to such things as wear and heavy attrition on the top and bottom teeth, reducing their height as we get older. The other problem with a bad bite is it creates an imbalance in the jaw joints, and the jaw joints, just like any other joint in the body, and if there's an asymmetry between left and right, if there's an imbalance, then the muscles are affected, the joints and the bones themselves can be affected. So there's a higher risk factor to developing jaw joint problems as we get older, related to having a bad bite.